acute surgical unit was actually established 10 years ago now. The reason for it was really to change the way we managed emergency surgery in general surgery, to have a consultant-led team, and also because the workload was getting higher, we needed to have a more, just a different mechanism and different system for managing these patients. So this was aimed to improve the assessment, early assessment of patients. It was protocol driven, so rather than having an individual surgeon deciding that this is what I do, everybody does the same thing, we work up the patients the same way. It's an independent unit of its own right, with its own registrar's residence and a nurse practitioner. And so, having introduced it, there's been a few changes in staffing with increased number of registrars and residents as it's got busier. We now have our own dedicated theatre, and we now have to have a second surgeon on in the mornings while the other surgeon is doing the ward rounds. Because we do them all acutely, that actually produces better outcomes. And Amy, one of our registrars, did a meta-analysis that got published earlier this year that demonstrated that because there used to be a debate about letting the acute cholecystitis, let it settle down and do it later, because when it's acute it's harder and you have more complications. Well, her study actually showed the exact opposite, that you actually have twice as many deaths, twice as many complications, and twice as many conversions if you actually let them settle and do them later. And so you're actually better off doing these patients acute and early. The data is very predictable in terms of what the workload will be for a given population. It's always been said, emergency surgery you can't plan for. That's nonsense. You can plan for it because you know how much you're going to get. You might not know how much you're going to get on a particular day, but over a period of time you know how much you're going to get. So within general surgery, you get improved outcomes with everything. And what would be the next challenging step is to do it in other specialties.